My name is Mustafa Shakir from Sammamish. In my research, I learned that Washington ranks in the bottom 10 states for total healthcare funding from the federal government at about $181 million. Given that over the next decade, rural communities are expected to lose over $4 billion in Medicaid, what changes do you think Washington could consider to better support these communities going forward?
Well, thank you for the question. This is a very important issue. I'm on the healthcare committee. For years before I got elected, I was also the rural health liaison for Congresswoman Kathy McMorris Rogers. And so I've been out visiting with rural healthcare for years. And it is a challenge. And Medicaid funding is continually a problem. Part of the reason we receive less is because on Medicaid, there's a federal match. So for the Medicaid expansion, so this is your able-bodied adults and some other populations that were expanded under the Affordable Care Act, the federal government reimburses or matches 90% to the 10% paid by the states. Washington has very low reimbursement rates for Medicaid services, which means that we don't get as much of that federal match as other states do. It's one of the things I believe we need to do is to increase our reimbursement rates because that's matched by the federal government. So if we put $1 million more into reimbursement rates, we might receive 3 to 9 million more in federal match. So this is going to really help augment our situation. With changes through H.R. 1 at the federal level, there is a lot of concerns, and I share those concerns. We cannot let our rural healthcare go under. We have to make sure it survives. And this is about priorities. So Washington State in the budget, we have to fund the most important things. Healthcare is essential for life and quality of life in rural areas, but truly without it, it's a life and death situation. So this is a high priority that we ensure that funding is here. I'm also advocate to our congressional delegation. 2 of the members of Congress overlap with my legislative districts, and I talk to both of them. I'm encouraging things like H.R. 1 allows for the states to apply for a waiver to have more time to implement the work requirements. I believe we need to get that waiver. Also, the rural transformation dollars. The federal government did approve Washington's plan, so that was positive. But we have to make sure that we are out looking for our rural health care and that we do not lose access to care. And I'm committed to that, and I'm doing everything I can on that front. We have to reduce regulations, address the underlying costs of health care. There's a lot of challenges, but you can count on me being a solid advocate for these providers and facilities. Thank you for the question.
Thanks for the question. So this is a subject that is where the state of Washington is in partnership with our federal administration, whether that's Centers for Medicaid Services, Health and Human Services, and it really comes down to how the formula for Medicaid allotments from the federal government are issued to the states, because Washington State overall is a relatively higher earning state, higher income state based upon our strong economy. We get less of a federal reimbursement on Medicaid dollars than, say, I think Mississippi is, the one that we look to where, their economy is generally not performing as well as the economy in the state of Washington. But that doesn't take into account the differences between access to care in rural areas versus urban areas. They each have their own individual challenges. Something that the federal government chose to do with the H.R. 1 that was passed July 4, 2025 was invest hundreds of millions of dollars, billions of dollars towards a rural healthcare transformation plan. I think I'm not convinced at the end of the day that policy is going to provide more health care to rural communities. So we need to be more thoughtful here in the state of Washington, working with our folks that represent those rural communities to make sure that those needs are met. And it's going to be a real challenge to continue to meet those needs. Things that I'm thinking about are, one of the issues with rural healthcare is access to providers. I mean, you have to travel long distances in order to meet someone and get treatment. The state of Washington has been very thoughtful about things like telemedicine, telehealth, making sure that you have access to a provider over the phone, over the internet. Now, while that still has its challenges based upon broadband and internet capabilities, I think with new technologies that are emerging, those communities are going to become more connected to just the world in general, and hopefully those folks can get access to a lot of those things via telehealth and over the phone. And also, we need to, make sure that we don't have a disparate impact on our critical access hospitals and rural healthcare providers. They are, heavily subsidized by the state and by the federal government, because without those hospitals in those rural communities, those folks they'd be even worse off without those critical resources. So it's going to be a challenge going forward, and I'm convinced that working with our partners in rural communities, though, we can continue to address the issue to make sure that the impact is minimized by the federal cuts to Medicaid overall.